Let's chat about the S3 heart sound. In some people, an S3 might be normal. So for example, if you've got a patient who's an athlete, maybe a child, or maybe somebody who's pregnant, an S3 heart sound might be normal. But in a lot of patients we see in critical care, progressive care, emergency, an S3 heart sound is often associated with fluid overload in the setting of systolic heart failure. You're going to best listen to it on the left side of the sternum, mid-clavicular line, fifth intercostal space, right where you listen to the mitral valve. And you're going to best hear it with the bell of your stethoscope because it's a low-pitched tone. So again, S3 in a lot of patients we see is a sign of fluid overload in the setting of systolic heart failure.